Hi, Joel.
Hi, Dion.
I came across a bill the other day that caught my attention. I did some research and wanted to discuss it with you to see if you would be interested in lobbying it.
Sure.
The bill died, but I believe we can give it new life. Let me give you a little backstory. So the bill that was proposed was a food prescription bill. It was based on the idea that food is medicine. The bill was intended to provide food prescriptions for medically supportive food, which includes nutrient rich whole foods like fruits, vegetables, and whole grains in healthy food boxes, healthy food vouchers, or renewable food prescriptions to eligible Medi-Cal beneficiaries. The bill is seeking to address chronic disease, healthcare costs, healthcare utilization, health disparities, and the social determinants of health by allowing Medi-Cal to cover medically supportive food. If the patient is qualified, they can receive this prescription from their primary care provider and obtain the healthy foods needed to help manage their chronic diseases. For example, diabetics can get food that is specific to diabetic diet. Patients with high blood pressure can get low sodium food. It provides access to a variety of fruits and vegetables. The reason this is important is that it helps people without the resources to live a healthier lifestyle. The United States spends $40 billion per year on healthcare costs associated with chronic conditions. Food disparities place people at increased risk for chronic health conditions. Some of the short term impacts of food disparities include malnourishment, obesity, and vitamin deficiencies, but some long term effects include morbid obesity, bone loss, uncontrolled hypertension, diabetes, cardiovascular disease, and even cancer. Black, Indigenous, and people of color, BIPOC populations, are at higher risk than other populations for diabetes and high blood pressure. BIPOC communities are more likely to be situated in food deserts with little to no access to healthy food options, especially fresh fruits and vegetables. Research has shown that consuming fruits and vegetables attributes to improved blood sugar in diabetics and decreased body mass index. The estimated cost of implementing the bill in 3 counties is $1 million to $3 million per year for a 2 year trial period. It allots about $25 to $75 per week per person enrolled, and the pilot will enroll 250 people from each county. Other fees include contracts and administrative costs. I would really appreciate it if you would be willing to have a look at this bill and see if you would be interested in lobbying for it. I'll provide you with the links for the bill so you can review it and gather more information.
Of course, Dion. I'd be more than willing to look into this bill concerning food prescriptions, as you have brought up key points about health disparity pertaining to food. Your health policy proposal can benefit our communities through prevention, treatment, and reversal of chronic health conditions by implementing a food prescription program. The adage, an ounce of prevention is worth a pound of cure, still holds up today in our healthcare system. It is better and easier for us to stop a health problem or illness from happening than to correct it after it has started. We can do this by initiating a bill, as you mentioned, that authorizes food prescriptions for eligible individuals who have or who are at high risk for chronic medical conditions. What do you say you and I approach Assembly Member Michael and we talk about this health policy?
Oh, I think that would be great. Thank you so much for inviting me with you.
All right, Dion, let's go ahead and do it.
Okay.
Good morning. Good morning, Assembly Member Michael. My name is Joel, and I represent a local nurses group that is calling for the government to enact a bill that addresses health disparities in our communities. I have with me the nurse group leader, Dion, who will provide her perspective and insight as to why we are advocating a food prescription program for you to support and authorize as a bill.
Good morning, Mr. Legislature Michael. Thank you for meeting with us today.
You're welcome. Thank you guys for bringing this to my attention.
Of course, we would like to repropose a bill that recently got killed. The bill allows healthcare providers to write food prescriptions for people with chronic health conditions as part of a treatment plan to improve the health of people that don't have the financial means to purchase healthy food.
I appreciate both of you, Ms. Dion and Mr. Joel, for presenting this issue to me. I do remember this bill, and while it sounds like a good idea, I voted no on the previous bill because I had concerns about the cost proposal associated with the pilot program. It's been quite some time since then. Can you both refresh my memory about the food prescription bill proposal?
Yes, Mr. Legislator. A food prescription is a specific amount of medically supportive food which is prescribed by a managed care plan or plan contractor that is based on evidence-based practices proven to prevent, treat, or reverse the effects of specific chronic health conditions. We are sure you know that there are many chronic health conditions that are overtaking this country, and many of those are due to poor quality food choices. Ms. Dion, can you please elaborate on these health conditions?
Certainly. Hypertension, diabetes, chronic kidney disease, arthritis, osteoporosis, and many other serious health diseases cost the government trillions of dollars a year. This pilot program may show success at helping people with financial disparities live a lifestyle that can help eliminate or control their chronic disease. It would increase their life expectancy and lower the overall cost of healthcare throughout the nation.
I see the intent both of you are making, but with the high prices of healthy foods today in California, I didn't feel $25 to $75 per person a week would be enough healthy foods to make a huge difference in preventing chronic disease. If both of you can provide a breakdown of a new plan that makes sense, I might support it next year. Also, how can enacting a food prescription program save our government money?
Yes, Mr. Legislator. We would love to go over our plan with you to get this bill put back on the ballot for next year. Food prescription programs have saved the government money through healthy eating. For example, one study estimated that a 30% subsidy on purchases of fruits and vegetables would prevent 1.93 million cardiovascular disease events, such as heart attacks and stroke, over the lifetime of the enrollees. It would also save $40 billion in healthcare costs. In addition, a 30% subsidy on purchases of fruits, vegetables, whole grains, nuts, seeds, seafood, and plant oils would prevent 3.28 million cardiovascular disease events and save $100 billion in healthcare costs.
Wow, those are impressive numbers, Joel. But from a clinical standpoint, Dion, what are the actual proven medical benefits of food prescription programs?
Food prescription programs address the problem of access to healthy and nutritious eating for low-income families, underserved communities of color, and high-risk populations. For example, African Americans, Latinos, and Filipinos are at higher risk than other populations for conditions such as diabetes and high blood pressure. There are several studies that have acknowledged the profound benefits of food prescription programs. For example, the improved blood sugar level in diabetics and decreased body mass index in the obese were attributed to increased consumption of fruits and vegetables among the participants. One study found that 72% of low-income families increased their food security after participating for several months in a pediatric fruit and vegetable prescription program. Another study found that a 3-year diet and exercise program lowered people's risk of developing type 2 diabetes by 58%.
Well, both of you have very valid and credible reasons for this policy. But do you both feel that the amount of money that was requested for this bill will be enough in order to support the pilot program? I feel that $1 to $3 million per year with the current cost of food would not be enough for the success of this pilot program. I also have other questions about the program. I understand that 250 people in 3 separate counties will be selected to initially start the program. Will there be a healthcare provider that will be selected to do the food prescriptions? Will the patients be followed by selected healthcare providers? I also have concerns about how the money will be spent. How do you intend to change this bill so that the healthy food options prescribed are properly utilized?
Yes, sir. We understand your concerns, and we would consider amending the bill so that initially during this pilot program, all 250 individuals in each county would have a handful of selected primary care providers who would follow the patients. The selected healthcare providers will be handpicked by the state due to their expertise in chronic disease management. Dion?
We would propose that the patients are followed closely by either their primary care provider or social workers in order to ensure that they are utilizing the resources and taking advantage of this opportunity to learn a healthier lifestyle of eating so that they can control so that they can maintain control of their chronic illnesses.
If you both can recommend to me the amendments to this bill that would give more provisions for how this money is utilized, and that there will be a social worker overseeing every step of the way that these patients are actually eating the healthy foods recommended by select healthcare providers, I will give you my support to move this bill along at the next assembly meeting. I would also recommend raising the limit of money from $25 to $75 per person per week to a more realistic number. I feel that the number should probably be double in order for people to be eating healthy foods on a daily basis with the current economy. We may have to rethink the budget, but this sounds like a great idea, and you have my support.
Thank you, sir, for your time and for your support of our health policy.
Thank you so much. I really appreciate your time. Mahalo nui loa.
Thank you.